Hello and a very warm welcome. Thank you so much for joining us. You're joining us on Zoom for the first World Horse Welfare Wednesday winter series of our webinars. That's quite a mouthful to say, and I'll have to say it again in a second when the team from Facebook Live will be joining us, which they'll do very shortly. So thank you so much for joining us on this week's webinar, which this year is on managing arthritic pain in our ridden horses. And joining us by Zoom, you'll be able to take part in the poll question and also ask direct questions into the Q&A function. And a very warm welcome to everyone who's joining us on Facebook Live for the first of Series 4 of the World Horse Welfare Webinar Winter Series. And this year is about, this week's is about managing arthritic pain in our ridden horses. And I'm delighted that we're being joined by Mary Smith and Rosie Owen, both vets, and considerably a huge reputation goes with both of them. I'm delighted to introduce them in a second. Just so you know, this evening's webinar, or today's webinar, is like all the other webinars we've been running since 2020, sorry. And so it's very interactive. So if you're joining us on Facebook Live, then please, for your questions, put them into the comments function. And if you're joining us on Zoom, then please put your questions into the Q&A function. By all means, use the chat function to chat amongst yourselves, but if you can put the questions into the Q&A function, it certainly makes my life a lot easier. And also within Zoom, the Q&A function, you can upvote questions that you like. So if there's a question there that you like, then please upvote it. I'll remind you of all of that in a while. This evening's webinar, or today's webinar, is divided into 3 sections. Firstly, Mary is going to give us a presentation around arthritis in ridden horses, or arthritic conditions in ridden horses, and then Rosie is going to join us for a structured Q&A, and then it's very much open to you. The bulk of the webinar is open to you to ask questions either through Facebook or through Zoom. So I'm delighted that we are joined by Mary Smith and Rosie Owen, and I will introduce both formally in a second, but I'll just now get onto the share function. And so that's where we are, managing arthritic changes in our ridden horses. And so this is Series 4. We first ran these webinars in 2020 and have now run them through the winter. And this is Series 4. I think it's our 47th webinar. All of the webinars we've run before are on our YouTube channel. We have a special education YouTube channel. We'll put a link up to that in the chat function so you can refer to that. And today's webinar will go straight up there afterwards as well. You can obviously refer back to previous webinars we've run. And obviously, please do, when, I know it'll be when you've enjoyed today's webinar, then please do refer your friends and colleagues to the webinar webpage on YouTube for them to be able to share as well. We will run these through the winter every 2 weeks, and our next webinar is on the 15th of November, and we will put a sign up to that, which is on equine ethology, with Renata Larson, and a sign up for that will also go into the chat function very shortly. So before we get going and I introduce Mary, I just want to, we've got a quick poll question for you. Do you own and or ride a horse that has been diagnosed with arthritis? And we've got 4 options there. You both own and ride the horse with arthritis. You own one but do not ride that horse. You ride one but do not own it. Or neither. So 4 options there. And whilst you're obviously, if you're joining us by Zoom, you'll be able to take part in the poll. If you're joining us by Facebook Live, please just put the answer in the comments section. But it won't be able to sort of obviously be added to the poll. So next time, please do register on Zoom, and we'll be able to take part in that as well. So whilst you're doing that, I'm going to introduce our first speaker, which is Mary Smith, who, as this slide sort of illustrates, has got a wealth of experience in equine orthopedics. Started life very soon as a specialist surgeon, did his PhD in managing different MRI methods, has had time in the US and more recently at Newmarket Equine Hospital, and she now runs her own teleradiology service, and she serves on Farriery's Registration Council, is a member of the Beaver British Equine Veterinary Association Council, and serves on their Health and Medicines Committee, and possibly most significantly of all, is also a trustee of World Horse Welfare. So, Mary, it's great to have you. Something you might not know about Mary, she's got a small holding at home, and there she has a bit of a Noah's Ark of animals: lop-eared rabbits, rescue chickens, 3 ponies, 3 horses, and 3 Springer Spaniels. She talks to all of them, which her family find very funny, but she says it's very rewarding, but doesn't tell me whether it's a rabbit, a chicken, the ponies, a horse, or the dogs which provide most reassurance to her. I love the idea. She's got a few scratches on her face, and that's because the Springer insist on bringing the same number of tennis balls home that they went out on a walk with. And the other day she was down one, so she was scrabbling around in the brambles trying to find the lost tennis ball. And if we do believe in reincarnation and we come back again and we get a choice, Mary would love to fly, and therefore she would love to come back as a bird. So before I hand the floor to Mary, Basil, can you give us the answer to the poll question? So exactly half of you own and ride a horse with arthritis, and then there's a good split evenly between the other 3 options. So what I can say from that is that you're all very much in the right place. So thank you for joining us. I'm going to stop sharing my screen, and I'm going to hand over to Mary. Mary, the floor is yours.
Good evening, everybody. Thank you for joining us on this evening. I hope you've all got a mug of tea or something suitable to drink while we begin tonight's webinar. It's a pleasure to be here and a pleasure to be talking to you about such an important topic that I can see straight away from that first poll as something that's of close to your hearts and is affecting many of you managing your own horses. So let's start with a definition or two. What is arthritis? Well, other terms that you might hear bandied around or used regularly by your vets are osteoarthritis or degenerative joint disease, or DJD. These are all one and the same. It's a very, very common condition. And much like ourselves, it will affect most horses and ponies as they grow older to varying extents. Different sites of the body may be affected in any individual. And unfortunately, it can mean that their ridden careers are ending at this stage. But it can also be that with careful management of the condition, many horses are continuing in some form of ridden work for years and years. So it's not all doom and gloom. And what we must try and do as vets is support you as horse owners and horse riders in continuing some form of ridden work where it is possible and where it is fair to do so in our wonderful animals. What are the causes of arthritis? Well, of course, general wear and tear, much like ourselves, that goes without saying. But there are things that we do with our horses that will cause repetitive loading of certain areas. A very strong example would be if we think about the mounted police force and the horses that have to do an awful lot of road work, particularly in London. These horses are stabled for most of their time. They are out doing road work day in, day out, with no access to turnout for many months during their times in the city. Of course, this means a lot of wear and tear. They get through a lot of sets of shoes, and their joints particularly are undergoing increased loading as a result. Less extreme at home, we can perhaps think to ourselves, right, well, when do I do my faster work and what is the going like, and how can I try to sort of alleviate going on hard ground to spare the joints in our day-to-day work and our competition exercise, and in the way in which we sort of manage our horses generally. Another way of causing arthritis is if there is direct trauma to a joint, and this might be with a knock during a jumping element or a jumping effort, or it might be from a kick. And in these horses, focal arthritis can develop secondary to that trauma. So you may feel that initially things have settled down, but some time down the line, that particular joint might be a joint that develops arthritis earlier than one might expect as a result of that trauma. Increasing age, of course, and then there is a breed predisposition to arthritis. We know that in Icelandic horses, for example, they can develop degenerative joint disease in their small hock joints, far more commonly than perhaps a typical horse population. And then we must think about genetics, along with the breed of the horse, are there particular individuals within a breed that are predisposed to degenerative joint disease? And if so, why? And how can we think thoughtfully about those horses when we look at potentially breeding from them and try to select away from characteristics within a breed or within a given individual that might predispose offspring to arthritis in the future? Common locations for arthritis are the hocks and the coffin joints, the pastern joints, but really any joint can be affected. And for example, in show jumpers or dressage horses that use a lot of flexion of their neck for their working role, arthritis within the neck or the cervical spine can be commonplace in those animals. This is a schematic showing us what some symptoms of arthritis might look like. If we imagine our normal joint is on the left of the screen, and what we can see is one bone meeting another bone within the bag of joint fluid, if you like. So there's a joint capsule where bone meets bone, and within that joint capsule is synovial fluid. On the end of each bone that enters into a joint, there is cartilage, and the cartilage is shown as this bright orange thick layer that should be nice and even throughout the end of each bone within that joint capsule. Now that's the sort of golden stage, if you like, or the ideal stage. As there is wear and tear throughout life and throughout use, that cartilage layer, that thick orange layer, will become worn and irregular. And as a result, there'll be areas within the joint where bone is in direct contact with bone instead of lovely soft cartilage meeting cartilage. And what this can mean is that the bone can become irregular, which you can see on the image on the right. We've got some knobbly bony spurs developing. And where the bone ends are rubbing together, this is uncomfortable and sometimes extremely painful. And what can happen as a result is that within that joint capsule, there is increased synovial fluid being produced, which tends to become watery and of less good quality. And so all in all, the whole package of that lovely shock absorbing bag of rich, gloopy, oily synovial fluid and that cushiony cartilage that should be meeting bone on bone becomes this bag of poor quality joint fluid and these raw modeled knobbly bobbly ends of bone there jarring against one another with motion. So when you think of it in those terms, it's easy to see why horses with arthritis become painful. These images on this slide are sections of tissue through the joint as viewed through the electron microscope. So looking at microscopy, we can look specifically at the cell types within tissues. And this top left image is the normal or the ideal situation, if you like, starting with a lovely thick plump cartilage layer on the innermost surface of the joint at the top of each of those bones. We've got lots and lots of plump purple cells, a thick layer of cartilage, which is supported by a darker purple scaffold, if you like, the subchondral bone. And then deep to that is the long bone itself and the trabecular bone. So this is normal, top left on the screen. As a horse goes through life and becomes older, that 4-year-old normal image, if you like, will shift towards the right. And perhaps by 10 or 11 years of age, we've got a thinner layer of cartilage in that joint, and we've got a thicker layer of bony scaffold supporting it. And so things are changing and adapting and wearing with age and with circumstance, but still potentially pretty functional. Then we might shift with time down to the bottom left image, where at 15 years of age, we've got less cartilage, a thinner layer of cartilage up there. And now what we're starting to see also is that within the long bones, deep to the bony scaffold, we're getting more pink and thicker, dense bone supporting that scaffold, which is supporting our thinner layer of cartilage. And what this is telling us is that the bones are becoming more dense as they are working harder in older age. And we feel that by this stage, probably horses are symptomatic to a degree. And then when you move over to the slide on the bottom right, you can see even more dense bone beneath the bony scaffold and a thin layer of cartilage on the top. And for sure, in these older horses, these joints will be joints that will be uncomfortable at times, possibly a little worse. And certainly on flexion tests, these horses would go unlevel. And we would certainly have a degree of arthritic old age in this situation here, bottom right. So whatever we do, we're going to see this pattern of progression or degeneration, if you like, within our joints or within our horses' joints. And then, of course, what can happen is that that pathway can be accelerated and happen much earlier in horses that are doing a lot of concussive work sooner in their lives or during their most active career. So what about a diagnosis, and is this important? Well, it really is important if we're going to plan the most optimal way forward for every horse to reach an accurate diagnosis. And the best way of achieving this is to involve your vet and to undergo a lameness workup, which will include localizing nerve blocks. This will allow us to hopefully hone in on the exact areas that are affected and then allow for targeted treatment, which is really important if we're going to get to the bottom of why horses are lame and if we're going to try and achieve improvement. Taking x-rays is an absolute mainstay when it comes to lameness examinations. And then moving forward from x-rays, when we see abnormalities, sometimes it's very informative to think about further diagnostic imaging, because this again can help assist with prognosis. Whilst x-rays are very good, what they do tell us is every change that has happened within that bony skeleton in that area. And sometimes these changes are historic and may not necessarily be part of the lameness pattern that we're seeing in front of us that day. So that's where sometimes reaching for MRI or some of the alternative modalities like a bone scan, a nucleus integrity, for example, can be a way of understanding whether or not the changes we're seeing on x-rays are active changes or whether actually they are historic and possibly not quite the cause of the lameness that we're seeing in front of us that day. The more accurate we are with our diagnosis, the more specific we can be with our prognosis, and the more specific we can be with our treatment and management plans. And then, of course, we need to think about regularly reevaluating things and adjusting that management as time goes on. Just a couple of x-rays here illustrating really some changes within the coffin joint and within the pastern joint on the radiograph on the right. So the left-hand x-ray shows us a focal osteophyte or chip within the coffin joint of this horse, and these sorts of chips are sometimes incidental in young horses. They might appear first during a pre-purchase exam, for example. You might not be aware of this sort of a change, but these are the sorts of things that can progress and can start to cause arthritic changes within a coffin joint. So we look for these quite carefully when we are screening radiographs and we're planning for potential risk to an animal for becoming lame or for developing arthritis in the future. So this would not be an ideal joint, and it'd be a joint that we would want to sort of consider and make a plan for. The radiograph on the right has some modelling of the short pastern bone, both lower down close to the coffin joint and also further up within the pastern joint. And these small bone spurs are relatively mild to moderate at this stage, but they are areas that aren't normal and areas that we would want to watch and potentially sort of consider treating or perhaps altering the management of these horses in order to minimise progression of these sorts of changes. When things are more severe, as seen on these two images from an MRI examination, we often are looking at end-stage osteoarthritis or end-stage degenerative joint disease. This first image on the left shows a much more significant modelling of the lower aspect of the short pastern bone. There's joint distension, and then the image on the right is from a different horse where actually you can see that the pastern bone and the coffin bone are in contact with one another because the cartilage layers have been completely denuded in that aspect of the joint. Along with that, you can see a lot of abnormal signal extending up into the short pastern bone and throughout the majority of the pedal bone or the coffin bone. And that's as a result of that bone-on-bone contact causing trauma and bruising, if you like, and fluid accumulation or inflammation within those bones. So MRI can be a very useful way of looking at some of the more significant sequelae, if you like, of having that arthritis within that joint. This is another MR image which shows us again fluid accumulating in both the short pastern bone and the coffin bone, and it helps us to understand why a horse might be painful in a joint that doesn't necessarily look too severely affected on a radiograph, but actually on MRI is active and is very definitely a source of current and active inflammation.
Mary, that's great. I've got a question. How old is the horse that you're showing there?
This horse here was only 7, which is concerning, but it was a horse that had done quite a lot as a young age. It was a horse that had been brought on young with a view to a show jumping career and had jumped successfully as a young horse. So a lot of wear and tear and a lot of schooling work, a lot of competition work as a young animal. And this particularly was a useful study to go on and do the MRI in this horse, because, as I said, on the x-rays, it didn't look too bad, but the horse was blocking reliably to the coffin joint. And the reason for reaching for the MRI examination was to try and sort of understand, well, why is this joint that doesn't look too bad on radiographs so painful? What's going on? And that's the beauty, if you like, of some of the advanced imaging that we can do these days. That the beauty of the MRI is that we really can see physiologically what some tissues are doing in response to the work that we're putting into them, and that can shed a whole new light on why something is painful.
Brilliant, thanks.
These two radiographs are hocks from the same horse. This horse was 10 years old, and the horse was a very typical example of a horse that was lame on one limb until it was blocked at the correct site there, upon which he switched to being lame on the opposite hind limb. And that's a really common sort of pattern that we would see during lameness workup. And when you look at the radiographs, it becomes apparent that we have modelling in the same location within the distal intertarsal joint on both the left hind and on the right hind. If you were to look at these two radiographs, having never seen the horse, as an equine vet, you'd probably say to yourself, well, I would put money on the left hind being the more lame of the two legs initially, simply because what we can see is irregular modelling in that left joint versus quite a nice round and smooth sort of convex modelling in the right hind, which shows us that this is perhaps more organised in the right hind. It's a more chronic pathology that potentially is becoming more stable with time. So when we're looking at some degrees of arthritis, it's not all bleak. There are joints such as these small tarsal joints or small hock joints that can start to model at quite a young age when a horse is first doing significant work. And then as those horses work through that work and become established in their career, these joints can settle and perhaps end up part fused, as is the case in the right hind there. And yes, there will be an uncomfortable period or a painful period of lameness there where horses need to be managed. But then as they move through that modelling stage and the joints become more stable in their modelled form that is adjusted or adapted to the workload, soundness can resume. And that can be a good example, if you like, of where an arthritic change is not a career-ending event, but is something that has to be managed. So what do we have as treatment options for arthritis? Well, there are a number of things, but for sure, a mainstay is often to reach for joint medications once we're sure that we've located the correct joint that's causing the bulk of the lameness. Steroids are generally the mainstay of the medications that we use. And as with use of steroids for other conditions, when we're using them, we're always mindful of the horse in front of us and whether or not laminitis might be a possible sequelae of injecting a horse with steroids, because occasionally there's a very small risk associated with using steroids and causing the onset of laminitis in a given individual. It's a low risk, and it tends to be a risk in horses that are already perhaps susceptible to laminitis because they're overweight. And it tends to occur, if it does occur, in horses where a lot of steroids are being used generally to treat multiple joints. So we're generally very aware of these complications, but it goes without saying that we always mention a small risk of laminitis when we're considering treatment with steroids into joints. Steroids are extremely useful, though, when they are used with care. And the reason that they're so useful in arthritis is that they will immediately halt the excessive inflammation within the joint, and that in turn will have a huge impact on reducing the pain in that joint. And in many instances, horses will return to soundness, which is really wonderful for everybody concerned. Now, that sounds fantastic, and yes, of course it is in the short term, but a steroid is not actually treating the condition as such. It's just reducing or removing those symptoms for a period of time. And of course, there will be a day when those symptoms will return. The pathology is still there and the condition is still there. And so use of steroids, if you like, is a short to mid-term solution that can be repeated for a short number of times. And then actually there'll be a situation where there are diminishing returns. So although it's a lovely start and often a very successful way forward for some time, it won't be a cure forever. Other treatment options that are absolute mainstays are using pain relief, the non-steroidal anti-inflammatory drugs such as bute or danilon, These are drugs that we use regularly in horses like this, and using low doses during our routine management of horses can be extremely effective in managing chronic pain as a result of arthritis. Other things on the list there for treatment options we'll discuss in a few slides' time. Farriery is crucial. Physiotherapy can be extremely beneficial. And then obviously looking at supplements or additional therapies such as swimming or hydrotherapy or even acupuncture can have their role too. When we're thinking about management, having reached our diagnosis and having decided on what the primary condition is that we're looking at and where the primary area affected is, we need to look at a rehabilitation plan in the first instance, and that will probably involve stepping work right down to some walking work. It's important that it is walking work rather than box rest, because the last thing we want to do is for the horse to stiffen up in other areas and for other things to start to become exacerbated as a result of confinement and a lack of exercise. So generally speaking, if it's at all possible, having diagnosed a horse with arthritis, we will aim to keep them moving and keep them walking, and we'll do that with the benefit of pain relief where needed. This is the time when we really need to consider the mid to longer term for each individual and try and adjust our expectations based on really the severity of the arthritis that we've identified, the joints affected, and try to understand what it is that we might expect to achieve with our horse once we have worked through an initial rehabilitation. Many horses, as I said at the very beginning, will be able to continue in ridden work, but some will not, and some will need to continue in less ridden work than before. And that's a really importance of conversation to have with people connected with the horse, and to sort of think through yourself in terms of your aims and your realistic expectations. Wherever possible, increase turnout if it isn't already 24/7. The reason for this is, again, to keep the horses moving and to help them act as their own best modulator, if you like, of their general overall mobility. Continuing on those painkillers is essential, and potentially adding in the supplements during this rehabilitation stage will allow you to work out what you feel is generally beneficial for your horse in your scenario and what actually is not worth perhaps continuing with. In addition to those things, weight control is key, and we'll talk about weight control in a few slides' time. And again, Farriery. We'll come on to Farriery. So 24 turnout, why is it so helpful? Well, as we've said, horses will naturally move around regularly when they are turned out, and this is because they're herd animals and they're natural grazers. This will allow them to walk off their own stiffness and ease symptoms such as pain and inflammation within their joints just naturally as they're going about their day. Obviously, it's a luxury sometimes to have turnout 24/7, and on many livery yards or even in your home circumstance, it might not be possible, especially during the wet autumn and winter months. What can we do in those situations? Well, certainly trying to initiate as much hand walking as possible is invaluable, and this can be done literally in hand. If you are down at the yard and you've only got 20 minutes, don't worry about brushing the horse, don't worry about changing the rugs, but pop a lead rein on, step the horse out of the box and do a couple of turns of the yard. 5-10 minutes like that 2 or 3 times a day can really make quite a difference to loosening off your horse and helping them to sort of manage generally day to day. If you've got the option of considering using a crew yard or a space indoors that's larger than a stable, where you can deep litter the bed or just have horses perhaps turned out in a pair, and allow them to move around more around a communal feeder or water site, for instance, then that can be a better way than having them shut up in one single stable, to allow them just to be moving about a little bit more than they would otherwise. So trying to think around the facilities that you may have available can sometimes be the way to sort of tackle restricted turnout on yards. If you haven't got much turnout, but there is a horse walker, then these can be beneficial. Most horses will adjust to going on a horse walker very well. It's important that they are safe and they are supervised, but generally once they understand what's expected of them when they step onto it, they will walk away quite nicely. And again, even if it's just 10 minutes, 2 or 3 times a day, that will make quite a difference. Generally speaking, if you can keep a horse in light, regular work year round, rather than that old tradition of giving them a chunk of time off, they will generally do better. They will be looser, more supple. They will tick over in terms of a degree of low level fitness there, which will make sort of bringing them back at the start of a competition season much more straightforward. They will walk off injuries, or it will reduce the number of injuries potentially that they may sustain too. And we think that's because it just keeps the whole system ticking along and ticking over. As soon as we start to rest horses for significant chunks of time, areas that perhaps are just mildly uncomfortable or a little bit less than perfect might start to become more stiff. Once something is stiff, something else becomes stiff. Muscle spasm might be something that contributes to a change in going. And before you know it, actually something that was perhaps quite a small problem can become a much bigger problem as a result of inactivity, much like in ourselves. So keeping in light work is really a top tip that can help keep many horses in ridden work for far longer than perhaps otherwise. The photograph on the bottom right shows a horse doing in-hand pole work, which is a nice way of strengthening the top line and again increasing the range of motion of the lower joints as they have to step nicely over the poles. You can even go on further and raise those poles to make them work just a little bit harder. And the reason for in-hand pole work like this is if you've got a horse that's starting to trip a little bit, or that is a little bit less careful on their feet than in their younger days, in-hand work is a very safe and reliable means of encouraging that stepping work and strengthening their upper body without you being at risk of them tripping whilst you're riding the horse. Now, the all-important weight management. This is a tricky subject and something that vets are concerned about, and something that we've seen becoming more and more of a problem generally in the industry. Just like in humans, when horses are overweight, there is increased load on all joints, which will increase inflammation and increase pain from these areas. They'll be less agile and less able to compensate for stiffness, and therefore prone to injury more readily. And of course, it's a vicious circle. Increased weight will lead to reduced mobility and increased symptoms of arthritis. This horse on first look, it looks like an idyllic photograph initially, doesn't it? It's a beautiful sunny day. It's a very glossy, shiny coat. The pasture is green and lush. There are little flowers everywhere and all looks very wonderful. But as soon as you look at that horse in detail, you can see where the red arrows are. We have significant deposits of fat. We have a crested neck. We have some fat sitting behind the shoulder, and we have quite a round tummy. All of those things are indicative of a horse, or consistent with a horse that is overweight and really needs to be addressed. What can we do? Well, managing weight is difficult. Maintaining turnout but restricting grazing is difficult. If you have the luxury of a grass-free bark chip turnout area, well, that's wonderful, but of course most of us don't. So then what we need to resort to are short spells of grazing in hand and longer times in areas where there's very little grazing, so that they are getting generally overall less grass intake. And of course, this is particularly important when the grass is growing actively during the spring and summer months. Using a strip grazing system or a track system like in the photograph on the bottom left there it works really nicely when you've got access to a field and you have the permission or the ability to put temporary fencing in to create the tracks. This pony is to the left of a temporary fencing, and you can see the grass is very nice and bright green to the right, but the pony is grazing much shorter grass that has already been grazed by two leaner animals prior. And so this pony will follow on the track system behind horses that really need the better pasture, and in this way limit his own intake. The image on the right shows a horse wearing a grazing muzzle. This is one of the sorts of muzzles that seem quite well tolerated, because you can see the nostrils are relatively free, it's attached to the head collar, and they can still get a good feeling that they are snuffling and grazing and sniffing and eating the grass in a relatively normal fashion, but they're just able to get less into their mouths and to bite less at any one time. And so generally this sort of grazing muzzle are tolerated quite well, although some horses do learn to flip them off with their feet and pull the whole thing off over their heads. So again, it's not the solution for every horse, but it can be a good way to try and limit calories taken in. Small hole hay nets And my favourite personally is to just rug up a bit less and stop using such enormous quilted rugs, particularly in the autumn, winter and spring months. It's lovely to keep horses dry and to have a rain sheet or a very lightly padded rug, but generally we don't need often the degree of thick rugs that are often used to keep our horses comfortable in the autumn and winter months. And bearing in mind their weight and their overall body condition score before we start to add rugs, I think is really important, as is checking them regularly over those autumn and winter periods, just to look at the effect the feeding regime in the winter months are having on their waistlines and their general body condition score. Just a couple of photographs to illustrate a thin horse top left. Ribs are clearly visible. There isn't much of a crest for sure, and we can see a lot of the spine, probably too much really over the withers, spine and rear quarters here. So we don't want to aim for this top left image if we can help it, but then we don't want to aim for the top right image either, where we've got a crested neck, quite a round rump and a rounded tummy. So we're really looking to aim for these images on the bottom left and the bottom right. And you can see that in these horses, as they're ever so slightly turned towards the camera, there's a hint of a rib or two that are visible. They haven't got a crested neck. They look really healthy and well, with a nice contour to their lower abdomen. There isn't a bulging tummy. And if you were to look at these horses from behind, you would see an N-shape silhouette over their back end, not an M. And what I mean is that we don't want to see a gully between the left and right quarters. We want to see a relatively rounded N shape in profile of that rear view rather than an M, if we've got a horse that is an acceptable healthy weight. Looking at Farriery support, a good trim is essential to handle horses with arthritis, and the reason that's true is because, of course, hooves are growing constantly and they will become long. And the way in which the hoof is involved in locomotion is critical. The longer toed horses will have a breakover point that is more awkward and is further forward, and each step will become more awkward for a horse that isn't regularly trimmed and appropriately shod. So we can support that, or our farriers can support that locomotion and that breakover by trimming horses specifically with arthritis in mind. When they're doing so and they're dressing the feet, using the tripod lengthways like this at a lower height can be a really sympathetic thing to do for these horses and help them to hold their limb in a lower position with less flexion required, which they will find more comfortable and will tolerate more willingly as a result. Rolling the toes on the shoes will help with that all-important breakover. This diagram is quite complicated on first look, but if you watch the footfall in the top part of the diagram there, you can see that as the foot is placed, there's a point of breakover at which the maximum force is exerted on the ground, and then over the foot goes and on to the next step of the walking action. And that's what we mean by breakover, this point at which the hoof is pushing down and exerting maximum force onto the ground and rolling over. So by rolling the horse's toe just in a subtle fashion and rolling similarly the toe of the shoe in that same fashion, we can ease that breakover and help the horse to make each step simpler and easier, and therefore they are less likely to trip. Other means of supporting the farrier and helping them to do a good job with your arthritic horse can be perhaps considering light walking exercise before the farrier comes to shoe the horse, just to loosen off the horse and allow the flexion of the horse to be a little bit easier during farriery. And then, of course, using bute in the morning feed or after farriery to help with aches and pains sustained is a friendly thing to do also. That brings us on to pain relief, a mainstay of treating horses with arthritis. There are many, many options, and many of you will be familiar with some of these and familiar with ones that work well for your own horse. Phenylbutazone or bute is commonly used and commonly available, but it doesn't suit every horse, and some horses are better with alternatives. Most pain relief does come in a form that can be left with owners. Having said that, they are prescription-only medications, but it's perfectly acceptable these days to ask for a prescription from your vet to allow you to perhaps shop around and take advantage of some drug discounts or various options or means to to procure these drugs in a perfectly legitimate way, but perhaps in a more cost-effective way if you are managing a horse long term. Physiotherapy is often overlooked once you have a horse with arthritis. I think people tend to assume that physiotherapy is really for horses that are actively competing and are trying to sort of achieve a certain sort of degree of work, and it's a very refined perhaps addition to your armory when you're managing your horse. But actually physiotherapy can be a lovely way of loosening off stiff older horses and allowing them to continue in their ridden role. When we use a physiotherapist, vets always reach for the ACPAT register, or the Chartered Animal Physiotherapists register, because these are professional human physiotherapists who have gone to the lengths of achieving an animal qualification. And they have their own website, which is on this slide. And for this reason, they are very specifically registered to do the job that we're looking for. Anybody else can call themselves a physiotherapist, but they may not necessarily, or they will not necessarily be specifically trained to treat animals unless they have that ACPAT qualification. And the reason this is important is because it's very important that people treating a horse know what it is that they're really looking at and understand what it is that they're trying to achieve. And so that specific knowledge of anatomy, physiology and biomechanics really comes into play here in terms of doing a functional and effective job in working with a horse to improve on performance. These photographs along the bottom of the slide show various stretching postures achieved and other exercises that you might be able to do with a horse in conjunction with a physiotherapist. And sometimes having a visit just once a month for 2 or 3 sessions can allow you to understand tricks and techniques that you can try with your horse yourself and can continue with your horse in between sessions, and to get this the experienced eye alongside that of your vet to help you sort of manage how best to work with your horse and work with the condition you have and yet keep them going. What about supplements? Well, there are hundreds available. And if you walk into any feed merchants, you will see shelves and shelves and shelves worth of products. And it can be overwhelming. And it really is a case of what on earth do we use? Well, the first thing to think about is the general feeding system you are using for your horse. And I personally can't emphasize enough that a high quality balanced feed already produced by a feed merchant, such as the many that are around, is likely to be your really good basic means of feeding vitamins, some basic minerals, and an initial all-round feed for good health to your horse. And trying to replicate that ourselves with individual ingredients is complex, and I don't think we are generally able to mimic so well the production of a feed that has really been researched very, very thoroughly by today's feed companies. So I think the first thing I would recommend is, if you don't have a feed in mind or you're thinking about a change, pick up the phone to feed companies themselves and ask to speak to a dietitian and explain your needs and the needs of your horse and get some advice. And then from there, you can start adding things that you might like to use in addition to a balanced, work appropriate feed. 2 favorites of mine are cod liver oil and glucosamine, really because there is some strong science to suggest that these ingredients do remain in the gut and pass through the gut into the horse's system rather than being just broken down and digested as such. They are mainstays of healthy joint fluid and potentially of healthy cartilage also. And so it's a good start point to consider feeding building blocks that will go hopefully into the horse's system and perhaps help with repair, or certainly help with ongoing maintenance of a relatively healthy system. Additional therapies. Water is a wonderful means of reducing inflammation and of improving mobility. It can allow muscle conditioning and strengthening without that repetitive loading that we're keen to avoid by avoiding too much road work. And if you aren't near something as beautiful as one of these water spas or water treadmills or swimming pools, getting out the cold hose before and after exercise can be a really nice way of just cooling down warm limbs or warm joints and really providing quite a benefit. you can do this, of course, as many times a day as you wish to or have time for. And of course, it's easy to get somebody else to assist you with doing that too. So you can think laterally when it comes to hydrotherapy and develop your own system. There are some very glamorous boots available as well that plug into the hose and allow you to give us a hydrotherapy sort of session locally to a joint with your horse just standing quietly on your own yard. So I think where possible, considering water therapy is beneficial. And finally, the last adjunctive therapy I want to mention is acupuncture, because I think a lot of people don't consider it for horses in the way that they perhaps consider it for small animals or for humans. And yet it has been around for decades within the horse as a legitimate veterinary use or veterinary treatment. And particularly, it's a useful treatment for treating pain and pain related to the musculoskeletal system. Quite often, horses with arthritis are painful or uncomfortable because they have got muscle spasm around that affected area, and that in turn puts another part of their body out of kilter, and so on. If you can relax the horse and relax those muscles that are in spasm around the affected area, you can achieve a much more freely moving animal who is much more comfortable as a result. When you ever see a horse being treated with acupuncture, the very fact that it is tolerated so well, I think, is testament to how, first of all, how little it disturbs them to have the procedure performed. And I think, secondly, to perhaps how enjoyable potentially it may be for each individual, although that's perhaps a little anthropomorphic. But it does generally seem to be tolerated extremely well. And again, it might be something that you consider for your horses on a once a month basis, or perhaps every now and then when you feel they are more stiff than you would like them to be. And it might be a lovely additional treatment that you can use that will allow you to reduce the amounts of bute that your horses are needing, and perhaps some of the other drugs also. And of course, the beauty is there's no withdrawal period prior to any competition. Well, I think I've talked for long enough, but just in summary, a few take-home bullet points, if you like. When we are managing horses with arthritis, let's really try and maximise their turnout. Keep them in light, regular work of some form or other, even if it's just walking around the yard. Maintain a healthy body condition score and watch those tums and watch those bums. Thoughtful, regular farriery with shoe adjustments, such as rolling the toes. And please do use regular low-dose pain relief just to help them help all of the wheels keep turning and help them to keep ticking over as best they can in a stable status quo. Periodic physiotherapy or acupuncture to alleviate muscle spasm, and possibly most importantly, regular review of the situation and what you have in front of you, the plans and aspirations for yourself and your horse, and adjust the management as you need to as time moves on. Well, thank you all for listening. And I know we have a Q&A session at this stage, so I'll stop talking and hand over.
Mary, that was brilliant. You covered so much ground there. I mean, just so many different webinars that we could take out of different aspects. And obviously equine weight management was one of them. And we put up the different the webinar we did on grazing systems. But Mary, that was superb. So thank you very much. And a really good sort of foundation for us to go into the next session of the webinar, where I just before doing that wanted to introduce Rosie, who is obviously very well known to Mary, not least because their careers clearly have followed very similar paths in generating the extraordinary experience that the two of them have. And Rosie started life, with equine orthopedics at the Animal Health Trust alongside the renowned Dr. Sue Dyson, as did Mary, then went on to Liverpool to do her residency in equine surgery, as did Mary. So much crossover there. And of course, Rosie is very close to the heart of World Horse Welfare because she works and has for a long time at Oak Hill Veterinary Centre in Lancashire, and Oak Hill provides the veterinary care for the Lancashire Rescue and Rehoming Centre for World Horse Welfare. So all in all, very, very close to home. And it's brilliant to have Rosie joining us, who, when she's not as a practicing vet, she's riding her horse Russell. I do love the name Russell for a horse, and competes British eventing at amateur level. And she thoroughly enjoys walking her dog Enfys. Doesn't say what breed Enfys is or whether he has a fetish with tennis balls, but we'll find that out in a minute. She's also an avid member of the ladies netball team and competes and plays at Premiership level, which is hugely impressive. And most winters, you will find her in the French Alps on her annual resident ski trip season. So, Rosie, it's so good to have you join us this evening. And so I will throw the first question just in this structured piece. Have you seen any cases of arthritis where you thought you were going to find one thing, but actually found something completely different, Rosie?
Well, firstly, thank you very much for having me attend and help a little bit, hopefully, this evening. And thank you, Mary, for a great presentation. And I think every day I'm surprised by what we find. No one day is the same as the next. So in my job, I do lots of lameness diagnosis. So most of my days are spent either blocking lame horses or doing some surgery to hopefully make their quality of life a bit better. So that's a bit about what I do. And for example, in answer to your question, I've recently been looking after an event horse owned by a lovely lady, and we knew that it had coffin joint pain. So every time I saw the horse, I would block its coffin joint and it would move significantly better. So I've always known for quite a while that it's had coffin joint pain. Like Mary said, the radiographs show historical changes related to the bones, and we could see that it had coffin joint osteoarthritis on its x-rays. And I've spent a couple of years now maintaining this horse, managing its overall exercise regime very carefully with the owner, managing its joint injections extremely carefully. We've used hydrogel, so Arthritic, which I know has been mentioned in the Q&A there. We've used corticosteroids at sensible intervals. So I try not to inject these high motion joints too frequently. We try and spread them out and use other methods of keeping the discomfort at bay. And I started to get to the point where I was struggling a little bit too much to keep this horse comfortable in its regular work. So we did perform an MRI recently, and Mary looked at the images for us, and we found that this particular horse had a very focal, complete erosion through its cartilage into its subchondral bone, just off the midline of its joint surface, so in the outer aspect of the joint surface. So this wasn't a straightforward, knobbly looking joint. It had a very distinct bone lesion within it, and also some abnormalities of the collateral ligaments that extend either side of that joint. And then with that knowledge, we were then able to explain why we were struggling to maintain its soundness. We were able to re-establish expectations with the owners, adjust the expectations of the horse, really. So it no longer needs to do eventing and can have a bit of a quieter life, but still has very regular exercise with this owner. So that was a really interesting case recently where MRI was really helpful. And I know it's not always available or financially viable, but it can just help give us that extra piece of the puzzle that we need sometimes to figure out exactly what's going on in these joints.
Brilliant. Thank you, Rosie. That's really good. Mary, I'm not sure we mentioned breeding, and how important is breeding in managing the long-term health of the UK equine population with regards to arthritis?
I think it is important. It's a really good question. We often reach or cheer ourselves up when we own mares with the idea that perhaps we can put them in foal once their careers are ending. And, you know, that's a lovely idea, and it does, you know, often work out very well. But I think what we must consider with horses with arthritis is, first of all, why have they got arthritis? And when it's early onset, we must consider why that might be and whether or not there is a degree of heritability to that early onset susceptibility. If it's due to direct trauma and there's a very logical story there, well, then that's one thing. And I think potentially those horses could be bred from. But if it's something that's a little bit of a surprise and not expected, and there hasn't been that obvious history of a lot of work, I think we need to think a little bit more carefully about whether breeding from those animals is the right thing to do. We don't know the exact heritability of the condition, but we do need to question why young horses might develop it and assume that there might be a link. Another time when it probably isn't wise to breed would be when conformation isn't perfect. And again, the horses can still have careers when their conformations aren't ideal. We know this. But if we have got horses with perhaps straight hind limbs, straight hocks, we know they're predisposed to hock OA. We know that this isn't ideal. Perhaps those aren't the best animals to be breeding from moving forward.
Brilliant. Thank you, Mary. Rosie, just picking up on the example you just gave just now, at what point would you start having a conversation with the owner about retiring horses from ridden work due to arthritis?
So I must admit, I try not to retire them, really. I try and keep these horses going and doing something, maybe not every day. There may become a conversation where we go, it might be best to give them a couple of days off a week, but actually doing a varied workload with them the other 4 or 5 days is actually beneficial to the horse. So if I've got a horse, we're probably talking here about the scenario where they have slightly more severe osteoarthritis, for example, problems, and we're starting to think, can they really cope with this? Doing things such as Mary suggested, like in-hand raised poles or in-hand pole exercises with them, just to get their joints flexing. I try and avoid letting the horses do repeated dressage work, lots and lots of small circle work that I think these horses can struggle with, the bends consistently, and go for an amble round the block instead for 20 minutes and try and do some straight line work at least twice a week. So I usually go straight lines for twice a week, an in-hand session, and maybe focus on going large around the arena rather than doing the smaller circle work with them. But I think the key is that establishment of that relationship with your vet, where they're having regular checkups to see, right, what lameness grade are they? Are they deteriorating with what we've done recently? Have they improved with what we've done and implemented recently? Are we on the right track with it? Is the horse enjoying it? That's often a question I ask myself. Is the horse enjoying the work? Or is it really reluctant? I think the one time where I really do tend to have that discussion with people is when the horse starts obviously tripping a lot. And I think that's a really dangerous situation I think it's unpleasant for the horse, and I think it's very dangerous for the rider. Horses that trip, in my experience, do so for a reason, and that really does need investigating and evaluating properly, because it's not a pleasant situation, as I'm sure we're all aware. You can have the odd stumble on your horse and it's absolutely fine, but if they're going down on a flat surface for no reason, I really do tend to advise that maybe it's time to have a think about whether it's safe for both the horse and rider to continue.
Brilliant. Thank you. You mentioned a lot there, and sometimes I think we need to do more about education around and awareness around lunging, because you see so many people lunging on very tight circles for quite a long time, and you just think that can't be good for even for fit and healthy horses, let alone horses that might be in a bit of pain. So thanks for that, Rosie.
That's really interesting, actually. For me, lunging only has really one use, and it's to make your horse safe to ride. So if you need to get rid of that little bit of buzz at the start, then to be able to ride your horse and get a productive session out of it, then that's fine. But I never lunge my horse, really. I do it very, very infrequently, because I agree. I don't think it's great for them on the whole.
Brilliant. Listen, I've got a couple of other questions, but I'm aware that we've got heaps of questions to answer, which is brilliant. So thank you very much for that. So just remind you, if you're on Facebook, put them on comments, and we'll transfer them across into Zoom. And if you're on Zoom, please put them on the Q&A tab. And there's so many really good questions that please, if there's one there that you like, do upvote them, and then they'll come to the top of the list, and we'll more likely get through them. So Rosie, I'll come to you first, because both Jane and Abby have asked similar questions, and Mary did talk about this, but both have asked supplements. Recommendations, please. What are the most beneficial supplements?
Well, the honest answer to that question is, from the studies that have been done, the most beneficial thing that you can do is give your young horse a supplement. So before there's any signs of osteoarthritis within the joints. So they tend to be more protective than they are symptom modifying. So I think once your horse has developed arthritis, you've probably missed the supplement boat. But it's the time at which we all go out and have a look and see what's available. Whereas perhaps thinking about your young horse as it matures and as it grows, getting its feeding correct, getting all of its nutrients correct, its copper in its feed correct, thinking about whether your horse might benefit from a glucosamine supplement at that point is probably far more beneficial than being reactive to an osteoarthritis diagnosis and then trying to find a supplement that works well. Now, I do often discuss supplements that contain boswellia, for example, or devil's claw. So there's Bosmerix by Hestervard, there's Harpagil that has devil's claw in it, and there's Echiflex Nodalox, which has a type of aspirin, herbal aspirin in it, where they have anti-inflammatory properties to the supplement, which for me might be a good step before stepping towards the bute scenario. So there are some horses that are just a bit stiff, some competition horses that can't have phenylbutazone or bute due to the withdrawal from competition times, and that you have to use something else that is competition legal. So I would often discuss those sorts of supplements. But like Mary says, if you're going to choose one, make sure you choose one that's high in glucosamine and potentially some chondroitin as well. I did go through a phase of advising green lip mussel when there was a relatively good study looking at improving the symptoms of fetlock osteoarthritis using green lip mussel extract. But I must admit, I'm not sure it's a life-changing thing to do. I think all these things like supplements and Farriery and physiotherapy and acupuncture, we're all helping to tip the balance from a slightly lame horse to a sound horse. They're not going to make a properly lame horse sound. In order to do that, they need vet intervention, an appropriate diagnosis, and appropriate anti-inflammatory medication that is only available from vets. And you just can't find those sorts of benefits in supplements.
Brilliant. Thank you, Rosie, for that answer. Kate asked Mary, should walking therapy on a soft surface be on a soft surface, or is a hard surface okay?
Oh, that's a good question. Ideally, somewhere in the middle, I would say. A little bit of give to a surface is very nice for the horse as they're walking along. It'll help them stay sure-footed, but you want that give to be consistent, for them to be able to take a sure foot reliably with each step that they're taking. So picking level ground and a fairly consistent going, I would say, would be the ideal. And that might be that it is a nicely mown area of the field or a verge, or it might mean that it is, you know, a track that isn't gravelly or stony or potholey, but something that's got a little bit to it rather than being concrete, and certainly avoiding boggy, wet ground where they're having to work and take uneven steps to sort of save themselves and find a leg is not ideal either.
Brilliant. And I'll stay with you, Mary, because someone's asked a question around your reference to ACPAT physios, and whether actually there's other animal specific therapists around level 6, level 7, PhD qualified and registered with the likes of RAMP. Why can't these type of therapists be considered?
I think they certainly can be considered. I think the first thing to say is that with any of these therapists, the most important thing is that they work in conjunction with your vet. they need to work that way legally, really. And if they are suggesting that they can come along and provide a treatment regime for you without perhaps first meeting your vet, or without wanting to meet on site together with your vet, then something isn't quite right. And that should be a little bit of a warning to you that perhaps things aren't as ideal as they could be. But certainly RAMP is a recognised organisation. There are vets involved in their constituency, if you like, or in their rules and regulations rather. And I think that is the way to go. A recognised qualification where there's been veterinary input is a really strong start point.
Brilliant. Thank you. Rosie, Audrey's asked, are stem cells used in horses with osteoarthritis?
Absolutely, yes. So I use them more now than I have done previously. So I use them where I'm trying to restore that cartilage surface to the best possible surface that I can do. So if there are some focal cartilage lesions within the joint surface, then I would use them. They're also carried usually in a plasma that acts as quite a good anti-inflammatory injection. So they are effective anti-inflammatory joint medications, and we shouldn't forget that. It's not all about trying to restore a joint surface. They are anti-inflammatories in their right in themselves. Now, we used to have to take bone marrow from the sternum of horses and expand the stem cells in a laboratory over a period of a few weeks, and then harvest the stem cells and inject them into the horse. Now there are companies that produce commercial stem cells which get rid of that invasive step. And I do believe that the cell count and quality that we get from these commercial products is probably superior from what we were harvesting. Now, the only problem is that there has been a recent recall of one of the chondrocyte-driven cell line stem cells that we were using. So the main company that produced it has temporarily, hopefully, stopped producing those stem cells due to a minor manufacturing issue. So they're not as readily available at the time that we are speaking now, but they have been previously, and I've used them very recently in a case of very severe osteoarthritis of a coffin joint. The horse was 6/10 lame in trot on a straight line. It was very overweight. It was a cob, and the changes on the x-rays were really quite severe. And I thought, this joint is probably not going to do very well with steroids. I think the response will be temporary, and it could be that we're giving it a temporary plaster, and actually it will be more painful afterwards once the effects of those anti-inflammatories wear off. So I opted to use stem cells, and within about 8 to 12 weeks of walking exercise, that horse was then 2/10 lame instead of 6/10 lame, and the owner was delighted. It was a massive improvement. It's just worth probably mentioning that some insurance companies will not cover you for stem cell use in your horse, so perhaps check your insurance policy before going ahead with those treatments, because I have had that issue previously as well. But now we also have another company who are producing a smaller batch of stem cells per month, so we've tried to order some today, and the next time we can get them in is like the 20th November. So it's sort of a 3-week wait. And they're produced from umbilical cord vessels and aren't driven down the chondrocyte, so cartilage pathway already. But they are pluripotent, so they in theory should transform into whatever environment the cells are placed into. Right. So we're stuck to a different type at the moment. But yes, we do certainly use them. They are expensive.
Okay. So
whichever way you do it, it is expensive because the products take so long to produce.
Yeah, sure. And so one for obviously having your horse insured and as you say, check with the insurance company. Mary, Helen has asked about regular injections for arthritis and how much damage these injections themselves do.
That's a really good question. Whenever we approach a joint, it's really important that we do it using full sterile technique. So clipping the area very carefully, very careful prep of the skin surface using a sterile glove technique, sterile needles, sterile syringes, taking every precaution we can to be sure that we're entering the joint space in a very sterile fashion there to put in the product that we want to use. Now, obviously, there are sites of access for every joint anatomically. It's important we know those, and then potentially we could rotate around those sites so that we don't get too much of focal or local sort of swelling and trauma to the tissues overlying the joint. I think Rosie made a really good point that wherever possible, if we're considering medicating joints over a number of times over the sort of mid to longer term, trying to spread out those injections is really helpful and will help avoid inflammation or flares, if you like, within the joint because of repeated injections. So although we sometimes like to give a course of 2 or 3 injections of something like hyaluronic acid or potentially a regenerative therapy, trying to sort of, having done 1 or 2 injections, trying to then pause for a bit and allowing everything to settle down, I think is very beneficial and will hopefully minimize the chance of any of those sort of adverse side effects from occurring. But the most important thing is that sterile technique whenever we go anywhere near a joint, and being really thoughtful about the environment when we're considering doing it.
I think that there's a big difference between how high motion versus low motion joints tolerate repeated injections. So your HOCs, your small tarsal joints of those lower HOC joints can tolerate multiple injections of corticosteroids quite nicely, in my experience. Whereas coffin joints, I think, are very, very sensitive. Stifle joints are very sensitive. We need to protect them at all costs and minimize the frequency with which we're entering needles into these sensitive high motion areas.
Brilliant. Thank you both for that. Rosie, sticking with you, both Polly and Jane have asked this, and it's something that Mary talked about, certainly in weight management. Should arthritic horses who are turned out 24/7 be kept warm with rugs when they otherwise would not need them?
I think movement's most important, probably, rather than keeping warm with rugs. So I think as long as they are not huddled behind a hedge, stood completely still, I think it's our responsibility as owners to go down and, like Mary says, walk our horses and make sure they are moving to keep warm. Obviously not all day, within reason. I think it's important to protect the horse's skin from the rain. So just a simple light sheet should be ample for these horses turned out with arthritis. And again, for me, like Mary said, just weight management is the single most important thing in prolonging the ridden life of these horses. So if your horse has a diagnosis of osteoarthritis of any joint, then trying to keep it fit, lean, with core strength is very important to keep it going longer term. And I think if that means that they wear very light rugs over the winter, then they're usually absolutely fine with that. We're far more bothered about it than they are.
Yeah. And I was about to say, horses are actually quite good telling us if they're cold. It's quite, they're not going to keep it quiet. They'll show obvious signs, won't they, of when they're cold. So thank you for that. Polly's asked also, Mary, is lateral work good or bad for arthritic horses?
Generally speaking, doing anything that is away from that steady straight line work is putting an uneven stress or strain on a joint. And while lateral work is very beautiful to watch, by its very nature, you are loading joints in an asymmetric fashion as they are moving laterally, and you'll be overloading one aspect of the joint periodically and then the other as they are moving. And of course, in dressage, it's a key component of everything that they do. But I think the answer with an arthritic horse is to do those sorts of things as little as you need to be achieving perhaps what you hope to achieve with that horse within its ability. So for example, if you have a horse that has done a lot of dressage and that they're at their level and you're very happy competing, relatively regularly, but you're very aware that you need to compete a little less, trying not to do too much lateral work and just doing enough to keep them ticking over and where you want them is worth it, as opposed to repeatedly performing the same moves again and again and potentially exacerbating something in an asymmetric fashion in a joint.
Brilliant. Comes back to the lunging point as well, doesn't it?
Yeah.
Let's go. Rosie, Sarah's asked, what would you consider low dose pain relief? Half Danilon or similar? Or on regular use of non-steroidals, how would you weigh up the risk of liver and kidney damage as well?
So it really does depend on the size of your horse and how much it weighs. So a Shetland's going to be very different from a Shire horse as to how much of that sachet you should be giving. For me, quite frequently, if we give the example of a 500 kilogram horse, I would frequently start them with a dose of perhaps 1 sachet twice a day for a period of 3 to 5 days. And then I would try and reduce it. So I would give them a slightly increased dose for the first few days, and then perhaps reduce it to half a sachet twice a day for a longer period of time. And genuinely, I don't worry about that sort of dose in a horse that is 500 kilograms. So the safe dose range is 2.2 to up to 4.4 milligrams per kilogram twice a day of phenylbutazone. Now, at 4.4 milligrams per kilogram, you're going to be giving 3 sachets twice a day. So if you're thinking that's the max, 6 sachets a day, that's obviously not appropriate for a horse long term, and it will lead to colon issues most commonly, so inflammation of the colon, colitis, and potentially other organ damage as well. But giving a horse 1 sachet of bute a day long term is very unlikely to affect the lining of the stomach and cause any gastric ulceration issues, which people always worry about. There have been studies that have shown that you need at least 3 sachets twice daily for over 30 days to change the bloodline, the blood supply to the lining of the stomach, to induce ulcers. So I think that we can be rest assured as owners that giving a horse 1 sachet of bute a day is very unlikely to have adverse health implications for them, and may be the best so-called supplement that you could possibly give your horse to keep them moving in that light workload that we're talking about for these horses that have osteoarthritis longer term, because it's an exceptionally good musculoskeletal anti-inflammatory drug, and we need to accept that as a population, that it is very good at what it is supposed to do.
Brilliant, thank you. And obviously, any treatment regime is going to be, it's going to be at the direction of your vet, and that's so.
And they will know roughly what weight the horse is, and they will be able to decide, how many sachets is appropriate for that size of horse or pony. Yes.
Brilliant, thank you. Mary, Kim's asked, you mentioned cold hosing towards the end of your presentation, and Kim said she associated with making joints stiff if they're arthritic, and she hadn't thought of using it post-exercise. But, warm arthritic joints are less painful. So why would cold hosing be a good thing?
It can be a really nice way of driving away inflammation, really. A good example is if the horse has been standing in for a while, having done their exercise, and things are just getting a little bit warm or feeling puffy and warm later on in that evening. Cold hosing can be, especially if you put a little bit of pressure over the water jet, so that you're sort of really causing a bit firmer pressure around the tissues around that joint. It can be a really nice sort of stimulatory thing to do, to sort of get the lymphatic system working, and to sort of drive out puffiness around the joint that it might be occurring just because that joint isn't as good as it used to be. So it's not so much perhaps treating internally the joint, but treating the tissues around it, and allowing them to sort of cool off and to perhaps restore and promote sort of healthy blood flow and shift that edema or that limb filling that you might sometimes see.
Brilliant. Now, listen, we are getting to that stage where I'm not doing a very good job, and everyone out there is doing a brilliant job because you're giving us lots of questions. So I'm going to ask Mary and Rosie if we can move into a bit of a more of a quick fire round now, so we can try and get through for more questions. And it was just brilliant to see so many people here today, and a truly sort of global audience from Sweden, Switzerland, Ireland, Italy, France, Romania, across the water in Canada, and then right across the UK. And I love the fact that we've got people from Land's End, from Inner Hebrides, from the Isle of Man, from across Wales, and everywhere in between. So it's wonderful to have you with us today. Thank you so much for joining us, and thank you for these questions. So Rosie, moving into our sort of a pressure darts round, what are your thoughts on Arthritis and anything else similar that you know of?
I'm a big Arthritis fan. So it's good at reducing synovitis, so reducing that pressure within the joint. We know that it stays there for a reasonable period of time as well. So I think it's an effective option. Yes.
Brilliant. Angie's asked Mary, I read a document put out by a supplement manufacturer that the efficacy of glucosamine is unproven in horses. What are your thoughts on that?
It's so difficult because there are varying studies with all of these supplements, and they're often studies that have been performed on animals other than the horse for various ethical and regulatory constraints. And we have to work with that. And I would say that is a concern. It's a concern with most supplements, that things are just simply broken down in the gut, and you're effectively feeding them your pound notes, and they're being digested in the gut and passing out as poo, which is not really what we want to see. But as far as we can tell, there are lots of scientific studies looking at glucosamine in different ways that show that in a horse, in a species with a simple stomach like a horse, there is uptake of glucosamine into the circulatory system there, which is a really good step towards suggesting it passes where it's needed into areas that need to heal. So a tricky one, and she's right to examine the studies carefully and critically. But as best we know, glucosamine has quite solid science behind it.
Brilliant. I'm not
that
sure.
wasn't fast, Mary.
I'm not sure they call iPad, but someone who's got an iPad has asked Rosie, can a splint develop into arthritis?
No.
There you go. I love that answer. I was advised by a vet, Nalda's asked, I was advised by a vet not to use a muzzle, as when you take it off, they work harder to eat even more. What are your thoughts on that? Rosie, because Mary suggested the muzzle earlier.
Absolute rubbish. Muzzles are great, so they're brilliant. I would say don't take it off and allow the horse to gorge. No, so if you're going to use a muzzle, then use the muzzle consistently. The horse only gets annoyed by it being taken away and then put back on again. If it's just part of their daily routine, they are absolutely fine with it. Sometimes just a bit of Vaseline around the muzzle to reduce abrasions for the first few weeks of using it can help. But I think they're fantastic and essential for many of our native breed types.
I think they're very quick to learn that a muzzle means a bit of grass, whereas no muzzle means no grass. I think that the ponies particularly pick up on that and start to tolerate it quite well. So definitely persevere if you've only used one once and then found it a disaster. Persevere. Absolutely.
Thanks, Mary. Kim's actually asked Mary, what grazing muzzle did you show in your slides?
Oh gosh, that was an American one. I forget the manufacturer's name, I'm afraid, but it's one I've seen in my feed merchant hanging up in different sizes, small to quite large. So it's worth shopping around and asking your local suppliers what they can get hold of through their catalogues. Your Horse Live is coming up in November, actually, so that could be a good potential source of shopping if anybody's near Stoneleigh in November, or Horse of the Ayrshire. Obviously, some of these large competition arena venues can be good sites for shopping.
Yeah, Rosie?
It's a green guard muzzle.
Yeah.
Green guard.
That's teamwork. I like that. Yeah. That's true teamwork.
Just Googled.
Rosie, Julie's asked, is there a preferred material that grazing muzzles should be made out of?
I think that green guard muzzle is probably the best one. I think sometimes you like the idea of the netting with the sheepskin all around, but I find that they sometimes are more, there's more friction with sheepskin. I think if anything's going to rub sheepskin, rubs really, girths, everything.
They seem to tolerate less that enclosure as well, don't they? When they're fully enclosing, I can see that's impinging on the nares and the sensory whiskers. I love the fact that the other is partially covering the important teeth area rather than the whole of the nose.
Brilliant. Kim's asked Mary, when we're talking about body condition scoring, no M shape even on a typical barrel shaped gypsy cob. So what were your thoughts on that?
Now there's a possible exception. I agree. I think you'll struggle to get a cob to be an N when they really are M's through and through, but I think there's M's and there are M's, aren't there? So perhaps a leaner M rather than a chubbier M is what to aim for.
Rosie, Becky's got a gelding out hock arthritis. The main issue we have is, despite being almost 22, his brain still thinks he's 3, and he tends to overexert himself in the field, with him being stiffer and sometimes sorer the next day. He's generally well managed on a veterinary horse supplement. Is there a better way I can approach his care?
Oh, that's a difficult one, because you don't want to stop them enjoying themselves in the field, because that's what it's all about, isn't it? Perhaps, she probably already does this, but taking some time to warm the horse up the next day after a period in a stable. So I don't know whether it is ridden anymore or not, but if it's ridden, then doing some good walking exercise before perhaps starting the trot work. But I think at 22, if they've got a problematic hock and he's a bit stiff after being in the stable overnight, it's probably okay, isn't it? It's acceptable if he's enjoying himself in the field. You could always ask your vet about introducing a low dose of bute and seeing if that eliminates those symptoms.
Yeah, and it's all about these benefits and risks, isn't it? It's all about making that balance as best as possible.
And of course, if possible, get them out full time is the other thing with a horse like that. Lots of horses stiffen up overnight in a stable.
Yeah. Mary, Angela's asked, my vets are now prescribing paracetamol. Is this as effective as bute?
Personally, I don't think so. I think bute is wonderful. I think Rosie did a great job of summarising it. It's so safe, and we have decades of use under our belts in terms of understanding it and understanding its therapeutic range. So for me, no, I don't think it's as useful a drug or as easy to administer in a correct and safe dose as something like bute that really has been tried and tested and developed specifically for the horse.
The only time I use paracetamol generally is an adjunctive pain relief alongside bute in laminitics that are struggling, and you don't want to go up those higher dose ranges. So adding in paracetamol with your bute can be quite effective for those sore laminitic cases, but not for osteoarthritis really.
Brilliant. Ellen has asked, Rosie, supplements for my horse that has Cushing's, anything that is safe?
Well, they should all be relatively safe, to be honest, for a horse with Cushing's. And I presume if it's been diagnosed with Cushing's, the horse is probably on some pergolide. So therefore, its ACTH levels are probably within relatively normal ranges. So you can take your pick at any of the supplements. Perhaps ask your vet for which ones they either produce themselves or that they advise and have experience with, because we all have experience with the use of a selection of supplements that we may find suit one horse type better than the other. So I have ones for older horses versus younger horses, and can advise according to the signalment of the horse, really. But
Brilliant.
she shouldn't worry about the Cushing's factor.
Perfect, thank you. And final question, sorry, we just can't have time to get through. Kim's asked, Mary, where do we look for a fully qualified acupuncture professional?
Best thing to do is to go to the website, which is on the one of the slides there. Really a great place to start, and you can put your postcode in and search your area and get in touch with somebody local to you that way.
Brilliant. And Basil will very kindly, it's always good to test Basil to check that he's awake, that we ask him to put that in the chat function. So Basil, if you could do that, that would be brilliant. Listen, I just wanted to say thank you to everyone for your absolutely brilliant questions. We've got through all the questions which had at least 2 upvotes and some of them which had 1. And I'm really sorry that we couldn't get through. Personally, I could listen to Rosie and Mary all evening, so thank you to taking part and joining us. And do remember that we do these webinars every 2 weeks. The next one is going to be on equine. We're going to be joined by Renata Larson, our equine ethologist, to discuss potential causes of aggression in horses and how to manage them. So that's going to be in 2 weeks' time on the 15th of November. We'll put a sign up there for you to sign up for that now. And if you're joining us on Facebook, do consider joining us on Zoom next time, and you can take part in the polls. We mentioned earlier, we're running these through the winter. So if you've got topics that you would like us to cover in future webinars, then please do email us on education@farriery.com. at worldhorsewelfare.org. So we have covered a huge amount of ground. Rosie, having heard all of Mary's presentation, all the discussion we've had, what would be your take-home message from our discussions today?
So probably don't panic if your horse is diagnosed with osteoarthritis of the joint. There are plenty of options out there to help, and it doesn't mean the end of a ridden career for your horse. I think weight management should be a key take-home message for those owners that have horses with osteoarthritis. It really makes a difference to how long your horse will stay functional for. Don't be afraid of joint injections. Ask your vet for all of the different options available according to the lesion type that your horse has, and get them to create an overall management plan with you, so that you know what type of work your horse is capable of doing and what you should be concentrating on week in, week out, because we need to look at the horse as a whole. And as I say, lots of situations can be managed long term, well, in the medium to long term anyway. So enjoy your horses.
Brilliant, love it. And Mary?
I echo that, really. You know, it's a team effort and there's so much that can be done. So don't be disheartened, don't be dispirited. Talk to your vet, talk to your other paraprofessionals that you trust and have confidence in. Make that plan and move forward in some form or other. Keep everything moving.
That is wonderful. Listen, thank you so much. And certainly what's resonated with me is that whole equine weight management piece, the importance of getting our horses to the right weight that they should be, that their joints can manage. And the fact that supplements only work in generally are more for the young horse than they are for the older horse. Actually, you can put arthritic horses out to grass without a rug. Who knew it? You heard it here first. So listen, a final thank you to Mary and to Rosie. That was absolutely wonderful. So much practical information, so much ground covered. Really appreciate it. So it's the first time both of you have joined us on a webinar, and you've made the fatal mistake of being very good at it, and therefore that makes it very likely that we're going to ask you back. So all I can say is thank you. Thank you to everyone for joining us. Look forward to seeing you in 2 weeks' time for our next webinar on November the 15th. In the meantime, take great care, and thank you very much indeed.
Pleasure. Thank you all.
Thank you. Bye.
Bye-bye.